You strike me very much as work hard, play hard.
Yeah.
And when you were here in the surgery center, you're in clinic. In clinic, you're seeing a lot of patients. When you're in the operating room, you're doing a lot of surgery. But then you also are very good about taking time off to be with your family, to be with your wife, in addition to traveling around the country, around the world, giving lectures, giving talks, giving back to the field, pushing our profession forward. Did you take any time off between residency and joining your dad?
I did not. And sort of, I could, in retrospect, it would have been awesome to, travel the world, go to Europe, do something like that. I remember pretty specifically, I was inclined to do that. I had a lot of my friends that were doing that, taking a gap year. And it would have been the perfect time. My dad was so itching to pass the torch. He had been burned out, like he's working so hard. He said, you know what? If you want to work for me, like my job starts July 1. I literally started July 1, right after residency. I remember I hopped in my car, packed up in Chicago, moved, and over the weekend, that next Monday, I was working and off and going. And so he said, you know what? If you work hard enough, there'll be time to take a vacation later. So and maybe 10 years later, there was time. So a lot of, I would say, I would generally advise that's a reasonable time to take the time off if you can. A lot of times that's not so practical. You have the job starting, you've got debt building. And so if you don't do it, then make sure you carve out time, every week to do something.